Hello everyone, let's try to solve this question together. So here we have a newborn infant who is admitted to the newborn nursery. She is in room air and being breastfed. A sepsis workup was done because of the maternal history of urinary tract infection. The positive blood culture report in this newborn infant correlates with, pause the slide, zoom the picture. So the correct response here is CIT ratio, which I will show you in the next slide how to calculate. Now let's talk about the sepsis risk. So first of all, let's see the blood culture. So here you see that it's positive for E. coli, as you guys can see there. So probably that is because of the maternal UTI. So it was a good call to do the blood culture on this baby. But look at the other side. Look at the deception created by, or false sense of security, I can use it's for a better representation, that based on the sepsis, when the baby is well appearing, there is just routine vitals are needed. There is no need for culture and no need for antibiotics. So that's why this D is wrong, and one has to be really careful. Sometimes we rely too much on the sepsis score, but this is the example where if there is a very strong history of baby symptomatic, then it's always good to go ahead and start antibiotics. But here we see that it was not correlating with the sepsis score, because according to sepsis score, there are two green for well appearing and a patient baby who is equivocal. So now what about neutrophils? So let's see neutrophils. Neutrophils counts are here, segmented neutrophils. So 37 is within normal limit. And what about bands? Yeah, band 7 is definitely high, but it's not directly related to bands. Now we are left with IT ratio, and I will show you in the next slide why IT ratio take precedence over these two values of the WBC. So let's calculate. And if you guys remember, any ratio above 0.2 is showing shift to left. So here we are. So we know that you remember that IT basically stands for immature to total. So that's the ratio. And here immature are bands and metamyelocytes, and mature are segmented neutrophils. So basically you add the immature and you add all, which means immature plus the segmented neutrophil. So once you add that, you get this, and finally you get this this value, which is greater than 0.2. And if you remember, like I said, greater than 0.2 is significant. It always represent serious infection or shift to left, significant shift to left. So I hope you guys have learned something together today. Please do like and subscribe to our channel, and you guys have a wonderful day. Bye.